Another question I get frequently is, I lost the weight, but I didn't lose the weight. Most people, as you know, if you've been following our conversations online, most people lose astounding quantities of weight with almost no effort. Just getting rid of the wheat and not indulging in other junk, not eating candy bars and drinking soft drinks all day. But there are people that, no matter how hard they try, just seem not to lose the weight. So what's wrong? Well, it might not even be diet. There could be other factors, and we'll talk about that in these series of frequently asked questions. But there can be factors in diet. So let's talk about those. Number one, too many carbohydrates. So it's a sad fact that 70 to 80% of people nowadays have diabetes, pre-diabetes, or what I call pre-diabetes. These are people who, when they eat carbohydrates to excess, trigger insulin, and it causes weight gain, or at least failure to lose weight. So the key here is to cut those carbohydrates. An easy way, an easy rule of thumb to keep in mind is to count your carbohydrates. Now we count net carbohydrates. When they list the carbohydrate content of a food on any nutrition label or any table, you'll see that it's listed as total carbohydrates, which includes fiber. But fiber is indigestible, so you can subtract that. So that's called net carbohydrates. Let's take a banana, for instance. A medium-sized banana has 27 grams total carbohydrates, 2 grams fiber. So net carbohydrates would be 27 minus 2, 25. Now, by the way, you can get tables of glycemic indexes online, various books. You can get carb counting books for a few dollars. You can get carb counting or nutritional analysis apps for your smartphone. So there's lots of easy ways to do this. We find that keeping your net carbohydrates to no more than 15 grams per meal or less is a very excellent way to facilitate weight loss. Another issue is a failure to take in enough fats and oils. If you're finding that you're still hungry, even though you've taken out wheat and its gliadin-derived opiates that stimulate appetite, and you're hungry, eat more fats and oils. And I mean that. I mean, when you have beef or pork, eat the fat. If you have eggs, eat the yolk. Use more coconut oil, more olive oil. Eat more fatty cuts of meat. Ask for the dark meat. Ask for some liver. You want the fat because it's very satiating. Dairy. Dairy's a problem for about 1 in 5 people. It's not the fat. It's the whey protein. So the whey fraction of protein triggers insulin. And in about 1 in 5 people, that amount of insulin triggering stalls weight loss. And so the only practical way I know of to find out if this is an issue for you is to commit to a 4-week period of no dairy. If you do that and weight falls off of you, 8, 10, 12 pounds, then this is a problem for you, and you should avoid dairy while you're trying to lose weight. Cheese, by the way, is the most benign from this perspective because when they make cheese, they skim off most of the whey. If it doesn't work for you, if you get rid of dairy and nothing happens, then it's probably not an issue for you, and maybe having dairy is okay, provided you don't have other sensitivities.